Each week, we're shining a spotlight on people in the area who are working hard to improve the lives of others.
And today, we introduce you to Michele Booth Cole. She runs the nonprofit Safe Shores. It's an organization helping abused children recover, and she's this week's DMV Doer.
When there's an allegation of abuse, a child has been harmed by abuse, we're the place where law enforcement, child protective services will bring that child. And we have staff who are trained to deal with child trauma, trained to talk with children in ways that children can understand and make their voices heard. And we have a comprehensive response. So we offer therapy, victim services, forensic interviews, all of those things centered around the needs of the child.
Some of your goals are to try and minimize the trauma that child has experienced. Talk about how you get that done.
That's exactly it. So we have a process, and it's a model, Child Advocacy Center. There are about 1,000 child advocacy centers across the country. We're the CAC for the District of Columbia, so we're the only organization in DC that does what we do. And really the sense of the model is, rather than the child victim have to go from place to place, office to office, agency to agency, all the partners who work on these cases come together at Safe Shores, the Children's Advocacy Center, and center around the needs of the child. So one way we deal with trauma is, one, by making sure that we're centering our process around the needs of the child. And then, as I said, we have staff who are trained especially to work with children who've experienced trauma. It's a very calm, peaceful, well-lit place. That's another way we deal with trauma, is making sure that the process feels very calm, because we want that child to know that these adults at Safe Shores have their back. We are there for them. One of the ways that we prevent it is by teaching adults how to recognize, respond to, and prevent child sexual abuse. We offer training free for the community, and we go into schools and youth-serving organizations and all kinds of places where adults are responsible day-to-day for caring for children, and we train those adults in how to respond when they think a child has been abused. So training, education. We also do education with children in the schools and teach them body safety and boundaries. So the way we do prevention is we make adults realize that preventing child abuse is an adult's job.
What keeps you going?
I work as part of a team, and I'm really there to make sure that all my colleagues have the resources they need to do their amazing work. So this work doesn't happen alone at all. I guess what keeps me going is the mission's a no-brainer. If children are safer, the world is better, right? I mean, from a mental health standpoint, from a physical health standpoint, I just believe in the vulnerability of children, the inherent worth of children as human beings, and we need to protect them, because it's cliche to say they're our future. They're actually our right now and our future. So that's really what keeps me going.